my name is Amber Goana, and I would like to welcome you to my Med Talk. This is going to be some of the things I pulled from the CPJE California law exam, and as you can see, it's going to be basically like a little Naplex, and so each video is just going to go over each section that I kind of pulled little things from, and I hope you like it. So for this section, we're going to be covering medications that have an FDA-approved indication in the use of thyroid disorders. So for hypothyroidism, your TSH level is usually going to be above 5.5. Your T4 total is going to be low. Your free T4 is also going to be low, less than 0.9. And your T3 total is going to also be low, less than 60 nanograms per deciliter. But it could also technically show normal. So for hypothyroidism, really the only thing that's going to be elevated is the TSH levels. For hyperthyroidism, your TSH levels is going to be low, less than 0.1. Your T4 total is going to be high. Your free T4 levels are also going to be high, greater than 1.8 nanograms per deciliter. Your T3 total is going to also be high, greater than 181 nanograms per deciliter. So really in hyperthyroidism, the only thing that's going to be low is your TSH. It'll be less than 0.1. So really when you're differentiating between hyper and hypo, you want to really kind of look at that TSH level. That's going to be your real indicator here. So some medications that you can use to treat hypothyroidism. These drugs are going to exhibit actions of your endogenous thyroid hormone. They're just going to give you an extra little boost of thyroid hormone. One option you have is levothyroxine. Synthroid is the brand name of it. You want to dose this by 1.6 micrograms per ideal body weight per day. This medication can be given IV or PO. IV is a little bit more stronger than the PO version, so the ratio is 0.75 to 1. This medication is made up of synthetic T4. It is the drug of choice because of its potency and its stability. It is safe to use in pregnancy. Then we have liothyronine. Cytomel is another name for it. You want to start at 25 micrograms daily and then adjust by 12.5 to 25 micrograms every week. This medication consists of synthetic T3. It has a shorter half-life, and it kind of causes fluctuations in the T3 levels because of that short half-life. It's known to show higher incidence of cardiac effects. Then we have Armour Thyroid. You want to start at a dose of 15 to 30 milligrams daily and then adjust by 15 milligrams every 2 weeks. This medication is actually made up of desiccated pork thyroid glands. So it's going to be a combination of T3 and T4. It's actually 1 part T3 and 4.2 parts T4, so it's mainly consisting of T4. 1 grain is equal to 15 milligrams. It is the less predictable option we got here, so it has less predictable potency and stability. And then the last option we have here is the Litrix Thylar is another name for it. Starts with 1 Thylar half tap daily. Then you want to adjust by 1 Thylar 4th tap every 2 weeks. So it's not really like a milligram per se, it's literally just a medicine that's tab, and they'll dose it based on like half tab and 4th tab. Just like the Armour Thyroid, it is made up of synthetic T3 and T4. It is 1 part T3 and 4 parts T4. So mainly, again, consists of T4. It requires refrigeration and it is also light sensitive, so you need to put it in a light resistant container. Very important. General precautions for all of these hypothyroidism medications: you want to avoid use in myocardial infarction, and as well as patients who are adrenal insufficient and it's not corrected. It can cause low bone mineral density. Some medications that can disrupt the hormone synthesis is lithium, iodine, and amiodarone. Some drugs that can displace the protein binding site, which will cause an increase in free thyroid levels. Examples are NSAIDs, furosemide, and heparin. The full effect is usually seen within the first 1 to 2 months. All of them need to be taken 1 hour before the first meal of the day or 3 hours after the last meal of the day. General side effects include tachycardia, palpitations, sweating, weight loss, arrhythmias, and irritability if the dose is too high. Those are just some, common side effects of hyperthyroidism. Monitoring would include the THS levels every 4 to 6 weeks until you see that normal TSH level, and then you can monitor every 4 to 6 months. You want to monitor your free T4 levels. Usually if the patient's pregnant or if it's more of a central hypothyroidism disease, you want to monitor your T4 level as well. Next, we have all the treatments for hyperthyroidism. The first option here is pipothiuracil. PTU is the shorthand version of it. It's 50 to 600 milligrams per day, and it's divided into 3 to 4 doses with a max of 1,200 milligrams a day is recommended. Preferred in the first trimester of pregnancy, and if the patient is experiencing a thyroid storm, this would be your preferred option using this PTU. It does not alter the existing T3 and T4 levels. This one you actually want to take with food. The mechanism that it works, it blocks the first step in that hormone biosynthesis by blocking the oxidation of iodine. You want to avoid in liver failure, agranulocytosis. It can cause constipation, a loss in taste. It can also cause drug-induced lupus. It can cause rashes. You need to monitor your CBC, your LFTs, and your thyroid function tests every 4 to 8 weeks. But then once you kind of get everything kind of stable, you can monitor every 2 to 3 months. Next, we have methimazole. Tapazole is another name for it. You have 5 to 60 milligrams a day divided into 3 to 4 doses. The max recommended of this medication is 120 milligrams a day. It is preferred in all the other trimesters of pregnancy. So PTU preferred in the first trimester, but methimazole in all the other trimesters. You also want to take this medication with food. The mechanism of how it works, it blocks that first step in hormone biosynthesis by blocking the oxidation of iodine, just like PTU. And you also want to avoid in liver failure, agranulocytosis. It causes constipation, a loss in taste, drug-induced lupus, rashes, and you want to monitor that CBC, LFT, thyroid function tests every 4 to 8 weeks. And then again, once everything's stable, every 2 to 3 months. Pretty similar to the PTU. And then we have potassium iodine. Lugol solution is a brand name for it. It is 5 to 7 drops every 8 hours. And this is something you want to start 7 to 10 days before you are having a thyroidectomy. You are having your thyroid removed. You also want to take this medication with food, and you want to dilute it in a full glass of water or milk. This mechanism, it works by temporarily inhibiting hormone release and interrupts iodothyronine synthesis by blocking organification. Effects are mainly kind of minimized after 10 to 15 days of use. You don't really see much more of a benefit if the patient uses it longer than 15 days. You want to avoid use in dermatitis, heart disease, pregnancy. If the patient's also breastfeeding, you don't want to use it. Once the patient has been treated for a thyroid storm, you want to start this potassium iodide 1 hour after that. It can cause a metallic taste, sore throat or gums. It's also known to cause welt patterns to develop on your skin and reduces anticoagulant effectiveness if you're also taking those. Monitor your TSH level as well as your free T4, T3 levels. This last option we have here is saturated potassium iodine. Your SSKI, or ThyroSafe is another name for it. It's 1 to 2 drops every 8 hours. Again, 7 to 10 days before a thyroidectomy. It also wants to be taken with food and diluted in a full glass of water or milk. It inhibits hormone release temporarily, and it interrupts that iodothyronine synthesis by blocking organification, and the effects again are maximized after 10 to 15 days of use. You want to avoid use in dermatitis, heart disease, pregnancy, breastfeeding, and again, just like the other one, you want to start 1 hour after those thyroid storm treatment has been in place. It causes metallic taste, sore throat, gums. Again, the whelp, it's literally just like the potassium one. Reduces that anticoagulant effectiveness. You need to monitor that TSH and the T3, T4 levels. So the PTU and the methimazole are pretty similar. And then the potassium iodide, saturated potassium iodide are very similar. For a patient who is experiencing a thyroid storm, some symptoms you're going to be seeing is a high fever, profuse sweating, very, very sweaty. Their tachycardia, their heart rate's very high. It's like 120 to 140. They are experiencing AFib, they're dehydrated, they're delirious, and they could even be in a coma. So treatment for a thyroid storm is going to consist of a beta blocker. Propranolol, Inderal, another name for it, that is the main beta blocker used in a thyroid storm. The dose is 40 to 80 milligrams every 4 to 6 hours. After you do this beta blocker, you also want to be giving the patient PTU and then iodine 1 hour later. So just like we talked about, so the potassium iodine or the saturated potassium iodine 1 hour later, after you give the patient PTU, you want to be giving them those drops. And then you want to start them on a corticosteroid. And those were all the medications that they had listed for an FDA-approved indication in the use of thyroid disorders. Again, my name is Amber Gawana, and I wish you the absolute best of luck in all of your studies.